So this is our second podcast.
Awesome.
We did one last week, and so that was kind of our tester. So
how'd it go?
We did pretty good.
Good.
Yeah, we had 2 college students, and so they were talking about, which I didn't even know. This is at Ohlone Community College. They have a youth community advisory board, strictly for mental health. And so they talk about all the different resources. They actually go around and work with the different college professors, talking about the resources and kind of bringing up depression and anxiety amongst the college age.
That's great.
Which I was like, what? I didn't know anything about that. It's great that you guys have that.
Where is that college?
It's in Fremont. It's a community college, Ohlone Community College.
Oh, okay.
And it's a small community college, but they are, just a great group. And I was like, wow, you guys are doing that at that age? I was a mess. You guys have it together. But they were really nice, these 2 young ladies. They came down and they're definitely advocates. And so, I think one said she wants to become a psychiatrist, I think.
Nice.
So that was nice. That was our first one.
Great.
So welcome, Dr. Donna.
Thank you.
You are our second guest.
Yay.
You were supposed to be our first guest, but we were still trying to get our podcast business together. So
that's okay. I'm here now. Number 2 is okay.
Thank you. So let's start off with if you can tell us a little bit about yourself and why did you choose to go into pediatrics?
Okay, so, I'm born and raised in a small town called Tulare, California.
Yes, Fresno, right?
Yes, in between Fresno and Bakersfield.
Yes.
Where the most exciting thing for our town was that we hosted the California Farm Equipment Show every year. That was our claim to fame.
That's it.
That was what we had going for us. Yes, and if you were a great student, you would get to go and actually be a hostess at the California Farm Equipment Show, which was fantastic because people came from all over the world to Little Tulare for this farm equipment show. So I met people from Germany, from France, in high school.
I'm so shocked. I am shocked.
Agriculture is a big deal.
Yes.
And so a lot of people would come into Tulare, our little town, and would spend the week because it was a week-long show. And so that's our claim to fame, California Farm Equipment Show.
I went to elementary school in Fresno.
Wow.
Yes.
Okay.
Yes.
See, I knew we had a connection, that Valley Girl connection.
Yeah, that's right. And so that's like, oh my gosh, that's where you were.
Yeah.
You were born and raised.
Yeah.
Wow. Okay.
Yes. And then I left after high school. I went to UCLA for undergrad.
Okay.
I majored in history and I did pre-med. Yes.
Okay.
So I wasn't a science major. Probably one of the first few people who went to medical school that was not a science major.
Wow.
As a matter of fact, when I came in as a biology major. I always knew I wanted to go to medical school.
Okay.
But
so you did.
I did know.
Knew that. Okay.
Yes. And I actually knew that I wanted to be a doctor since I was in 3rd grade.
What?
And when I became a senior in high school, I knew I wanted to be a pediatrician. So I've known for a long time what I wanted to do.
I love that.
But when I entered UCLA as a biology major, I went through our first year of biology classes, and I hated it.
Really?
I hated every second of it.
No.
And I said, I cannot do this for 4 years. So I went to my counselor, and I said, I need to change my major. Can I change my major? And she's like, well, what do you want to change it to? And I said, history. I love history. I love writing. I love reading. Yes. And she said, oh, you cannot change your major to history. There's no way you get into medical school if you change your major to history.
Wow. Okay.
And you have to know, my mom is one of those moms who's like, you could do anything. Like whatever you put your mind to, you can do it.
Yes.
And so I'm not really from the thought that there's nothing I can't do it. Yeah. So I told my counselor, well, I'm going to go to medical school and I'm going to change my major. And she said, it's a huge mistake. You'll never get into medical school. And I said, well, we'll see.
We'll see about that.
Yes.
And look.
And look, here I am. Don't think I didn't send my counselor a note.
Did you follow up like, told you so?
Yes. When I got that admissions letter, I said, that was me, remember? But I changed my major to history, and I did pre-med. And then after college, I did 5 years because 4 years was not enough for me to do my history major and take all of my science classes.
Okay.
So I did college in 5 years, not 4.
Okay.
And then after college was over, I just needed a break. So I took a year off.
Oh, you did?
Yeah,
Okay.
I did. Before
Okay.
I went to medical school, and I just hung out. I worked, but I hung out.
How nice. Yeah, enjoyed yourself.
I enjoyed it. I traveled and, went to see friends and just lived for a minute because it'd been 5 straight years since high school with no break.
Of just
and
pure
I just
studying.
Pure studying.
Yeah.
And I just really wanted to just take a pause and then go into medical school. So I did. I took my year off. Something else that people now are doing that's a trend. But then back in the 80s,
it was kind of like, what?
It's like, what are you doing?
Yeah.
You can't do that. You
Right,
don't
get
take
back to
breaks.
work.
You don't take breaks.
Right.
So
keep going.
Yes, but I did, and then went to medical school, and I stayed at UCLA for medical school.
Okay.
And then I moved up here to the Bay Area, Oakland.
Yeah, so you
for
really
residency.
switched. You went from a Southern California lady to Northern California lady. Okay.
But I feel like I'm still a Southern California lady at heart.
You spent a lot of time up
Bay
there.
Area folks, but I love Southern California. I think it's the weather.
Yes, it is
Yeah,
beautiful.
it's beautiful.
And then the beaches.
And the
because we have
beaches,
beautiful
yes.
water here, but it's just cold.
Yeah, you can't get in the water.
You can look at it, but the beaches, oh my gosh, are absolutely beautiful.
Yes, I spent a lot of time at Venice Beach and Santa
I
Monica
love
Beach.
Santa Monica, that's my favorite.
Yes,
my favorite place.
It's hard to beat that, in the Bay Area. Like you said, the weather's nice, it's temperate, but like I really like heat, from the Central Valley.
Yes.
In the summer, I like my summers hot.
Yes.
And
me too.
Yeah. And you just don't get super hot here in the Bay Area.
Yep, it just kind of stays cool.
It stays too cool. And you still have to wear a sweater at night. I don't like that.
Yeah. I agree. I'm with you on that. Yes.
But I moved up here to do residency. So I did my residency at Children's Hospital, Oakland.
Oh, you did?
I did. Yes.
All
yes.
right.
And then after my residency, I did a fellowship in adolescent medicine. I did a year at UCSF.
Okay.
And then I started
too.
working.
Wow.
Yeah. So that's kind of my, I guess, educational route to get here.
Yes.
And then I worked in various places for 20 years, just really experiencing everything. I worked outpatient medicine, which I don't really like. I really enjoy hospital-based medicine.
Okay.
So the majority of my career is hospital-based medicine.
Okay. Which means you just like being in the hospital,
yes,
right? Versus
I like being
outpatient.
in the hospital.
Give me an example of what does
So
that mean?
outpatient is like, well child visits. So you bring your
Okay.
doctor to have like, this is my doctor, right?
Okay.
I do all your checkups every year. And if you're sick, you come see me.
Okay.
That's the type of medicine that I don't like to do.
Got you. Okay.
I really like fast-paced, really not knowing what I'm going to get next type of thing. And that's what you get in the hospital. You get called down to the emergency room. You have no idea what's coming in. I attended deliveries. So you have no idea what's going to happen in the delivery. And then I took care of babies who were sick from their delivery, so in the neonatal ICU. So I took care of them.
Okay.
And then we also took care of well babies, and they were nice to have like a nice cuddly, well baby. But I like the fast pace, not knowing what's coming next, and just kind of keeping my adrenaline flowing. So that's why I like hospital-based medicine.
Okay. Yes, because I would imagine it is fast paced, and then you have folks like me coming through. I remember I will never forget my daughter was I was working and she was with me at work and she was coloring, and somehow we were in like a community center, and somehow she inched over to the paper cutter. And I said, no, and, just stay away from that area. And so I went back to doing what I was doing. And, of course, she was maybe about 8. So still just very curious and kind of like, I'm going to do it anyway. And she was taking her little project, whatever she was working on, and she tried to just, I'm going to cut a little piece of paper. And next thing you know, there's blood. And I said, oh, my gosh. So we went. And that was the one time I had to take her to emergency room. And I was freaked out because I didn't know how deep the cut was.
Right.
And they just took such good care of her.
Yeah.
And now we kind of were able to joke about it. I'm like, remember that time you didn't listen to me? And we had to go flying through emergency. Oh my gosh. But they took such good care of us. So yes, that was, but it was intense.
Yes, it is, and it's like at the height of when you're like, as a parent, seeing your child injured, right? And seeing blood, not knowing if that bleeding is going to stop, not knowing like how injured your child is. Are they going to be okay? Are they going to have to come into the hospital? Are we going to have to do surgery?
Yes.
Or all these questions. So that's the kind of stuff that I like, to be able to come in and just, calm the parent during that time. And, really just be able to say, okay, I'm going to help you and your child. And I don't know. For me, I feel like it's like a kind of a bit of a calling, because when people are in their worst time of their lives, I want them to have somebody who is going to help them through it.
Yes.
Not just someone who's going to be abrasive or mean or, not have any sympathy for what's happening. So I guess that's how I rationalize it's okay for me to like sick babies and not well babies.
Yes. And you know what? I just want to take a moment on behalf of just the HHREC, myself, and the entire Oakland community to thank doctors and nurses and just everyone who work in hospital settings. Even recently, my dad, for the first time, I had to take him through emergency because he's getting older, and I've never seen him sick. I've never seen him not really feel good, not be the strong man that he is.
Right.
And this was at Alta Bates, and the doctor there, we went through emergency, and I mean, we're high level and just intensity. I was freaking out. And the doctor there just took such good care, the emergency doctor, he just took such good care of my dad. And he was explaining to me, I'm like, can he get pain medicine? He's in pain. And the doctor's like, we're going to give you pain medicine. But then he went a step further, which I really appreciated, because I didn't quite understand what he was talking about, but he was still kind enough to explain the pain medicine is one thing, but I'm going to do A, B, C, and D, because what's happening needs to get undone. And so I have a way that we're going to do that. And you may not see it, but I know what we need to do. And so, but there's going to be some pain, but that will stop. And he was so great at explaining that. And the nurse, they were so great. And my father he was good, and he got out of there. And so I was just so grateful. I am so grateful for doctors and just hospital staff. You all really take care of us when we are in trouble. So and do your very best to do that. So thank you for the work that you do. And I do want to segue into, would you share with us, have you had any challenges being just an African American woman in the field of medicine? And in the sense of, I know even in my industry, in the nonprofit industry, there's cultural differences. Have you had any experiences maybe that come to mind just with you being an African American woman, in this field?
Yeah, I mean, I think just being a woman, you're automatically, like, for example, my husband and I joke about this all the time. I can walk into the room with my white coat on. I can introduce myself and say, hi, I'm Dr. Carey, and have a full-blown conversation with someone. And then they'll say at the end, well, when is the doctor coming in?
What?
I just talked to you for like 10 minutes. What did you hear? But there is something that happens for some people that they see you and they cannot reconcile doctor and black woman and put them together in the same person.
Oh my goodness.
So while I might be giving them information, and it's obviously doctor level information,
right,
they still couldn't hear.
Just can't put that together.
They just can't put it together. Or many times I've been walking down the hallway and someone will say, nurse. And
it's like, no.
It's like, I literally just left you. You know that I am not a nurse.
Right.
But so it happens all of the time. And people, just will rationalize it. Like, it just happened like maybe 2 weeks ago.
Really?
I was at my vaccination clinic site. I wear my white coat that says doctor. And I'm walking around asking people if they had questions about the vaccine. And I came up to this white couple. And I probably maybe 3 or 4 people in front of them, I had said, "Oh, hi, I'm Dr. Donna," and I was asking them if they had any questions about the vaccine. I know they heard me.
Yes.
So I came back. Then I came to them because I was kind of doing, every 3 people just to make sure everyone got the information.
Yes.
And I came up and I said, "Hi." And before I could say my name, they're like, "Oh, are you a nurse?" And so I said, "No, I'm a doctor." And they were like, "Oh," and I was like, at that point, sometimes I get a little smart mouth. And I said, "White coat, doctor on my lapel means I'm a doctor." And they're like, "Oh, no, well, we just thought." And I said, "I understand. I understand.
Yes.
It didn't register to you that I could be a doctor, but I am."
For everybody to put that together. That's
so
interesting.
That happens.
And even as of, a few weeks ago. Wow.
Yeah.
Wow. And so, okay. Yeah, my grandmother, she, just being from a different generation and seeing different things, she used to always tell me, it's never, you're never going to stop being questioned. And she just kind of raised everyone in our family to, always do your best, be your best, and just know that you're going to have these types of things that happen every now and then, and you just keep right on a trucking, right on a moving.
Right.
And so it's just, but, her words are just ringing true.
Rings true. All the time. Yeah. It's like I've been a doctor over 23 years, and still I'm getting people questioning, asking, that will assume, it's easier for them to assume that I'm a nurse.
Right.
Despite the white coat.
Despite
the doctor on my name. I mean, my name says it right here. Right. And so, despite that, it's easier for you to assume that I'm not a doctor, that I'm anything else but a doctor.
Yes.
Just happened to be wearing a white coat, calling myself doctor.
Well, thank you for being vulnerable and sharing that too, so that folks can hear that, because I think that's it's just good to still share those stories. And thank you for that. I want to speak with you about some of the effects from COVID-19 now, and I mean, this has just been a time that none of us were prepared for.
Right.
There's been so many adjustments that we've all had to make. And it just seems to me, from what I've been reading, what I'm seeing in the media, and just talking to community members, that African Americans have been affected really in the worst way from COVID-19 on all levels, not only just from getting sick, but even, folks losing their jobs, and there's all of these different effects with even housing and, going down, mental health issues. And so what have you seen in terms of the effects of this with African Americans in Alameda County specifically? What can you share about that?
Yeah, so, there was already a huge disparity of health in the African American community, even before COVID. And so when COVID hits, of course, the communities that already had, minimal access to care, was not getting all of the care that they should have been receiving for well child visits and well adult visits, right? Not going to the doctor as they should. That, medical racism, cannot leave out medical racism, not being treated like with the same types of medication, the same types of, care given to them. That when a pandemic hits, that of course that community is going to be hit harder.
I've never heard that, medical racism.
Oh, yes.
I mean, I the concept, but just to hear you say that, wow. So,
there have been tons of studies of African Americans going into the hospital and receiving different care, not being heard, not feeling, particularly around maternal care and Black women, not feeling like their pain when they're in labor and childbirth is the same or needs to be addressed in the same way as pain from a white woman. And going to the emergency room saying, "Hey, I'm having difficulty breathing." Not having that taken as seriously as if you are a white person coming in saying, "Hey, I have difficulty breathing." So the way we have really accessed medical care is different. And is not the same at the high level that we need it to be for everyone.
Okay.
And so starting there, then you get a pandemic that comes and ravages through a community.
Yes.
Who now has the highest rates of cardiovascular disease, right? We have the highest rates of heart disease. We have the highest rates of incidence of cancer. We have the highest rates of high rates of obesity, diabetes, all of these in our communities, that when we get a disease that targets people who have
right, all this
all
going on
above, right, makes you a high risk, then of course it's going to impact our community even more.
Yes.
And so that's what we saw with COVID. We saw it come and hit and really hit our community really hard. And then on top of our community being sick, then you still have to battle the medical racism. Mm-hmm. So you're sick, you still have to go to the hospital, and when you get to the hospital, they dismiss how sick you really are and send you home. And then you go home and die. And so we are just seeing that play out time and time again. We saw that play out in every level of economics within our community. We had doctors dying in the hospital from COVID because they weren't being listened to. And so at every level in our community, it doesn't matter what your educational level is, that medical racism reared its head and impacted us during this time of COVID. So we're battling the disease itself.
Yes.
And then we're still battling the racism that occurs when you go to seek care and treatment for this disease.
So that is all this working against us.
All of this. Yeah.
Yes.
Yeah. And so then your family members say, well, I'm feeling bad, but what's the use of going to the hospital, because they're just going to send me away
back home. Right.
And so then you don't seek care until it's too late. So then you're on the ventilator, and then we had so many, we don't really know the numbers because no one was really taking note of it in the beginning. No one was really looking at who was really dying, whether they were black, whether they were white. The reports were just people were dying. But then finally, doctors started saying, I'm seeing more black people dying, right? Black doctors were saying, it's us that's dying.
Yes.
And then that's when people started paying attention to it and keeping statistics and data. But early on, we really don't know how many people we really lost. I'm sure, in a few years, once we're kind of really through the pandemic, people will go back
and be able to
look at it.
Yeah.
But really right now, we don't have great numbers. But we do know from right now that blacks are 2 times highest number in terms of hospitalization and twice as likely to die from COVID than white people. So we know that right now. But what was it before? It might have been higher, might have been the same. But we know that right now, twice as many cases, twice as many hospitalizations, twice as many deaths.
Yeah, that and just going through, this year and last year, it just seemed, it really did feel that way, that we were suffering as a community. We're already, like you said, to your point, we're suffering before, just with everything that we have going on with diabetes and heart disease. But then to add this on, it's like, okay, we kind of are afterthought almost when it comes to some of the other cultures and receiving care. And so, thank you for sharing that and for opening up about that, because I'm even looking at this from, even with all of that, then there's the other part. There's once you figured out, or you were blessed and lucky enough to maybe not have gotten sick, then there's this whole other part to this, the mental health part. Because if you are a parent, especially with young children, and like for me, I have girlfriends who are, single mothers, and some of them have 1 or 2 children in the house, little ones, and you're still trying to work. So you're working, and then you have the kids in the house, and some families have gone through this and they've been able to maintain, but a lot of the mothers that I've spoken with, especially who are black mothers, their children and them, the anxiety is high, depression is kicking in. Even with me, I have a 15-year-old, as I was sharing with you before, and she already was struggling with anxiety. But it kind of just shot up because she's pulled away from her peers. This is her first year of high school, supposed to be. And so, she's trying to navigate, how do I do school remotely?
Right.
Even, just give you an example, I started paying closer attention when I would go in her room. I would just kind of peek in the beginning. I would just peek in, hey, are you on that laptop? Are you in class? Now, when I go in, I look at, are you sitting at your desk or are you in the bed? Is your window open or not? Are you getting fresh air? Are the blinds open? Because it's looking a little gloom in here. It's kind of dark. Are you all right?
Right.
And so I've definitely started doing that. And I think it has made just that little detail of, okay, let me do a little mental check and let me look at your room and see, is it looking depressed in here? Or, do you have light and fresh air flowing in? Are you looking crazy in the face? What's going on?
Right.
And so I've been kind of in her business more than I normally would be, only because I know that her anxiety, and I've also, I want to thank Kaiser because she has been working with her a therapist and the psychiatrist, and they have been just very patient. And her primary care physician, Dr. Tataputi.
I know Dr. Tataputi.
Yes, we love Dr. Tataputi.
We love her too. Yes.
She has been a staple for a long time, helping kids, and so she has just taken excellent care of my daughter. And but I'm talking to other parents and girlfriends of mine who some of their children, it's anxiety and depression, suicide, thoughts, that stuff is creeping in. I've heard that from some of my colleagues and other girlfriends and parents. And I remember you telling me the last time we spoke a little bit about the suicide rate, right?
Yes,
it has increased.
Definitely. And younger. So, just like with the adults where we had, high rates of cardiovascular disease and cancer and diabetes, and then coronavirus hit and it just made those people even more at risk.
Yes.
It's the same with our children. So, our children already dealing with anxiety, depression, trauma, basically being a child in Oakland.
Yes.
For most of our Black children, there's trauma. There's the constant fear of homicide, the constant presence of homicides. That causes trauma.
Yes.
And that then, we know there's studies, right, that talk about this trauma and how it rewires our neurons to think differently, to react differently. So you're hypersensitive, you're hyper emotional, right? All of these things that we're seeing play out in our kids, which we think that our kids are just doing too much or acting too much, but it's really a physiologic response to the stress, right, of their environment. And even though you may not live like I live,
their environment.
I live in the hills, right? But I hear the gunshots every night. Even though my kids are not living in that, in what we call the bottoms or not living there, they can hear the gunshots.
Yes. Yes.
And so what kind of stress? They're still stressed.
Yes, and on high alert. And high alert. What is going on?
Definitely to a lesser degree than a child who's actually living there and right in the midst of it.
Yes.
But still, that's the type of stress that our children are under. So now going to school is like an outlet, right? They get to play, they hang out with their friends, they get to draw. It's like a nice 6-7 hour day of them being able to escape.
Yes, and be in that kind of safe, nurturing environment. Right.
Now we've taken those kids and we've sent them home because they couldn't come to school. And now 24/7, they're in this stressful environment.
Yes.
So no wonder that our kids have are anxious, more anxious than before, are feeling more depressed, have thoughts of suicide because there's no escape. The only escape that they can even imagine in their little minds is death.
Yeah. Yeah.
And that's a scary thought to think that our children's only escape is death. And we're seeing it younger and younger and younger. We're seeing 8 and 9-year-olds commit suicide.
Goodness. Oh my goodness.
Versus not seeing them that young, prior to the pandemic. But that age has been creeping down. And when you think about also, like you said, you go into your daughter's room and you peek and see what is she doing? What is she watching?
Yes.
What is her environment like? That's what we have to do. You have to see, what are your kids watching on YouTube, right? What are they watching on TV? Because a couple of these kids, many of these kids have learned how to commit suicide by watching YouTube videos.
Yes. Yes.
You can find anything on YouTube.
Yes.
Anything.
Like
and
scary.
so they're learning how to harm themselves on YouTube. So you have to pay attention to our kids. But like you said, if you're a single mom and you have a job that you're still working and you have multiple children in your household, like really, how equipped are you to be paying that close of attention to your children?
Right.
During your 9-to-5 job.
And even I had one of my girlfriends, we recently had a conversation, and her daughter is 15 as well. And, she's like, well, she called me basically needing a vent. And in the midst of her venting, I'm listening to her say how concerned she is about her daughter. And she's like, okay, we've had to call her a therapist, and, I'm really worried about her. And I said, well, what about you? Because you sound like you're getting ready to lose it too.
Right.
You need to do something for you. Get your exercising going, get your breathing, go outside and walk. Get some fresh air, get out of the house.
Right.
Maybe you and her need to get out on a Saturday, get out of the house and go walk, go do something together, and be able to just kind of relax yourselves. Because I'm like, you're talking about her and I hear you, but I'm listening to you. And so I'm like, that has been kind of a common conversation that's been happening. And so it is really It's been a lot. It's been a lot. And I'm telling folks, even the staff here, be kind to yourselves.
Yeah.
Take it a day at a time. Try not to overwhelm. And same thing with me. Just like, hey, if certain things aren't getting done, if I have to push it off to the next day in order for me to be okay and to breathe and just relax, and I just have to do that, hey, I'm not going to fall apart.
Right.
Because we're dealing with a lot.
Yes, absolutely. Absolutely. But the fear is, and the issue is that I really hope, like organizations like that you have are really helpful, because what you're doing is you are trying to teach people how to de-stress, right? We've had so much stress in our lives as African Americans, right? That we oftentimes don't have the luxury of taking it easy or the luxury of resting.
Right.
Organizations like yours that have lots of different ways to help people cope. Because what we needed in this pandemic was something we never had before. We've never not been able to communicate and fellowship with your neighbor.
Yes.
Right?
Yes.
So usually if your girlfriend's going through a hard time, you go over to the girlfriend's house, you bring some food,
and say,
we're going to sit and relax and talk.
Yes.
We couldn't do that during the pandemic.
Right.
Everybody had to stay in their own environments, their own households. Well, now you're like, okay, well, that's one of my coping mechanisms. I get to hang out with my friends and family. I can't do that.
Right.
How then do I de-stress? What do I do to calm myself down so that I'm not screaming and yelling at my kids who are, their anxiety level is high.
Right.
So
everybody in the house.
They're bouncing off the walls because they have all this pent up energy that they didn't get to go outside and run off.
Yes.
And now they're running around doing crazy stuff in the house, and you're stressed because you're trying to work and they're home 24/7.
Right.
Eating 24/7.
Like,
eating 24/7.
You getting another snack again? I told my daughter, you're going to have to get a job in a minute.
Yes, and the financial strain of that. The financial strain of that. If you're barely making it, and now you have kids home the whole time, and when they're bored, they're eating and they're snacking. Yes, and you think, hey, this is supposed to last me for a week, and now it's lasting you 2 days.
Right. Right.
What are you going to do?
Right back at the grocery store.
Right back there, yeah. So, really what we need in our community right now are creative ways to de-stress.
Okay.
Because even though we're starting to open up a little bit, we still are not full blown, right?
Right. And speaking of that, I want to just wind down and talk briefly about the vaccine.
Yes.
Because both of us are vaccinated, and my daughter is, like I said, she's 15, and she's wanting the vaccination, and I've been hearing that we're getting closer to that age group.
Yeah.
Can you I don't know if you have information on that,
I do.
or you can speak about it.
I haven't done as much reading on it as I want to do, but I do have some information. We know that Pfizer is doing 12 to 15-year-old trials. They just finished the trial.
Okay.
And they're going to the FDA for emergency or extension of their emergency use.
Okay.
Down to the age of 12.
Okay.
That's expected to happen in the next week or so.
All right.
So maybe by the beginning or middle of June, we might have the vaccine that goes from 12 and up.
Okay, which is that's a good thing. Yeah. That is definitely a good step.
Absolutely.
And I'll just share this briefly. I was in the hair salon recently, and black hair salons, and I started looking around, and I was like, people are getting a little lax with their mask. Mm-hmm. So I was looking at that, and then I was, so I was asking, hey, I've had the Pfizer vaccine, so I was sharing that. And then most of the folks who were in there were saying that they weren't vaccinated. And I'm like, whoa, this is a little scary. So you guys you're kind of getting lax with your mask going, and you haven't been vaccinated. And then it almost we got into an actual conversation where kind of like half of the salon was pro-vaccine, and half of the salon was like, well, we don't know what that is. And we let you guys be the guinea pigs. We don't want that. We don't know what they're giving us. And so I am following. I have you to help us and talk to us. We have other doctors and black doctors in our network, thank goodness, who we trust and we listen to, and other community members like our pastors who have been advocating.
Right.
And I've been, what I've been telling people is, do your own research. You don't have to listen to your friend or anybody. Do your research. Talk to people who are in the medical field, who actually went to medical school, not they're just Googling something, and come to your conclusion. And then you make your decision. But to not do anything and you're just kind of like, oh, well, hey, I'm like, I don't think that's too smart. And so, but I also get the trauma behind it. I totally get everything from Tuskegee experiment, all the experiments that have been done to us. I get it. But I'm also like, well, what about the education? What about the research, for yourself? Right. And so I just thought that was interesting, being in the salon, and kind of half were like, we're not getting that. We don't care what you say.
Right.
And then the other were like, well, no, we're going to get it. We feel safe. And so I just wanted to kind of bring that up.
Yeah, I mean, I think, there's this whole thing about hesitancy, right? And I've never liked that word hesitancy, because I think in the black community, it's called wisdom, right? We have had years of being mistreated by the medical and the scientific community.
Yes.
So when they bring out a brand new vaccine for a virus that we've never seen before, and they do it in record-breaking time, like, for you to not question is a problem, right? So I'm all for questioning. What I don't appreciate about a lot of things that, conversations that I'm hearing in our community, is that we're questioning this vaccine, but we haven't questioned anything else that we've ever taken.
What about the flu shot? Because I get that once a month.
We've never questioned that diabetic medication that you're on. You've never questioned
that you carry around.
Never questioned your medicine.
Your asthma pump.
Right, for your high blood pressure. You've never questioned that. You have cancer, you take chemotherapy drugs. You've never questioned that.
Right.
We have horrible eating habits. Right. You never question that.
Right.
So now all of a sudden you're hyper questioning the vaccine. Though that's what I'm most irritated about. Yes. I'm not irritated about the questions if you're going to question and you're going to be listening to my answers.
Yes.
And you're going to be open to what I'm saying. I have no problem. I can talk to you all day long and you can ask me 50,000 questions and I will answer to the best of my ability because I know you're open and you're trying to receive it.
Yes.
But when you're just questioning, you don't know why you're questioning. You're just questioning for the sake of questioning and you're not hearing my responses. No matter what I say, it's, well, I'm not going to take it. Well, you're not open.
Right.
And those are the people that I have the most problems with, because I bet you I can count 4 or 5 other things in your life that are probably more dangerous than this vaccine that you've never opened your mouth to question. So that for me, it's like question with an open mind and being able to hear the responses. If the responses still don't make you comfortable, I understand. But at least you've been open and you've heard what we're trying to say. And you're getting your information from people who are actually knowledgeable.
Yes, that's the key.
Right. But we like mess. So we'll get it from somebody who just has a YouTube channel who just wants to talk about it and have no scientific basis for what they're talking about. Right. Oh, so-and-so said, what degree does so-and-so have? What education does so-and-so have? What does so-and-so have to land on to say this is where I'm getting my information from?
Yes.
Don't just come with conspiracy theories.
Yes. Well, thank you for that. Thank you for that feedback because that is so important. And I want to take this time again just to thank you for coming and talking to us, Dr. Donna. I got to get the name right. Dr. Donna White-Carey.
Yes.
Got it. Okay. And you have your Talking with Dr. Donna, which is your podcast. And so if folks want to look you up, they can look you up on YouTube your podcast. And what we're going to do is we're going to post a resource form for our community members who are going to watch this podcast so they can see other providers out there. You know, if you need phone numbers to call, even if it's suicide related, you know, if you're looking for a crisis centers, anything that falls under this kind of Alameda County Behavioral Health, we're going to put up some resources for parents and for young people and for youth. We're going to do that. And I'm also going to put up information and links to our mental health services, Alameda County Mental Health Services website. And so we will put that up. And we just want to thank you. This has been wonderful. Thank you for being our